Hello, dear students. Your today's topic is abdominal syndrome, chronic gastritis in children. Chronic gastritis is a chronic, recurrent, focal, or diffuse inflammation of the gastric mucosa with impaired physiological regeneration processes, impaired secretory, motor, and often endocrine function of the stomach, the possibility of developing atrophy, as well as the presence of certain clinical symptoms. The main reasons for the development of chronic gastritis in children are infectious factor, Helicobacter pylori, drug factor, taking non-steroidal anti-inflammatory drugs, corticosteroids, sulfonylamides, etc. The presence of duodenal gastric reflux, a combination of the above factors, long-term persistence in the body of viral infections, certain disease like Crohn's disease, celiac disease, and autoimmune factor. Risk factors for chronic gastritis: elementary, chronically erratic nutrition, and simultaneous alteration of hot, cold, and spicy food. Helicobacter pylori associated infection. Invasive, require EPGTS as taking biopsy material from the colon. Histological, cytological, bacteriological, and biochemical urease test. It is first method or invasive. And second method, it is non-invasive, serological breath urease test, determination of Helicobacter antigen in feces using monoclonal antibodies, and PCR. Classification. Sydney classification of chronic gastritis. First, etiology, autoimmune, associated with Helicobacter pylori, reactive, which includes drug, mixed, idiopathic, special forms, which includes granulomatous, lymphocytic, and eosinophilic. Localization, antral, pangastritis, and fundic. Endoscopy, non-atrophic, atrophic, process activity, active phase, inactive phase, diagnosis, examples, chronic, non-atrophic associated with Helicobacter pylori, pangastritis, active phase. Second, chronic, non-atrophic, antral, reactive associated with GHT and gastritis, active phase. Chronic autoimmune atrophic pangastritis, active phase. To characterize morphological changes in the study of biopsy of the gastric mucosa, a visual analog scale is used, with the help of which it is possible to determine the degree of Helicobacter contamination of the mucous membrane, detection of up to 20 microorganisms in the field of view, first degree, up to 50 bacteria, second degree, more than 50 bacteria, third degree. The activity of the process is determined by the degree of infiltration of the colon by polymorph-nuclear leukocytes, mononuclear cells, and lymphocytes, which normally contain no more than 2 or 5 per field of view, or 2 and 3 mononuclear cells in one roller, indicate the chronicity of the process. The presence of even 1 to 2 plasma cells indicates chronic inflammation. Diagnosis of chronic gastritis. The diagnosis is made on the basis of complaints that can be combined into 3 syndromes: painful, dyspeptic, and astheno-vegetative. Anamnestic data, objective data, and additional research methods. Standard for diagnosing of chronic gastritis in children. There are laboratory and instrumental methods, general blood analyses, biochemical blood tests, which includes total bilirubin and fractions, AST, ALT, alkaline, phosphatase, amylase, VPAS, blood test for markers of hepatitis, and examination of feces for the presence of an intestinal infection. Examination of feces for X of worms. Coprological examination of feces, general urine analysis, ultrasound of the biliary tract, liver, gallbladder, sclerotic breakfast, pancreas, esophagogastrofibroduodenoscopy with targeted biopsy of the colon. Research on Helicobacter by at least 2 methods: intragastric pH-metry, the method of external electrogastrography. There are differential diagnosis of chronic gastritis by localization, syndromes of antral gastritis and pangastritis. Treatment of chronic gastritis. There are 3 stages in the treatment. First stage, gastroenterological or somatic department. Treatment in an outpatient clinic is acceptable. Clinical conditions with strict adherence to all recommendations. Second stage, treatment in rehabilitation centers. And last stage is dispensary observation of gastroenterologist polyclinics. Nutrition for chronic gastritis. Therapeutic nutrition is prescribed adequately to the severity of the patient, sparing diet for up to 30 days and moderate restriction of chemical and mechanical stimuli of the gastric mucosa and the receptor apparatus of the gastrointestinal tract. Excluding hot snacks, seasonings, spices, dishes are boiled or steamed. The rhythm of nutrition is fractional, 5 to 6 times in 1 day. There are also nutrition for chronic gastritis. First stage of treatment. Purpose of treatment: elimination of clinical symptoms, eradication of Helicobacter pylori if detected, in accordance with the provisions of the European recommendations for the management of Helicobacter infection in children, and correction of the secretory and motor disorders. There are also drugs for treatment: chronic gastritis prokinetics, myotropic spasmolytics, proton pump inhibitors, H2 histamine blockers, antacids, cytoprotectors for erosive gastritis, and also physiotherapy, laser therapy, magnetic laser therapy, inductothermy, electrophoresis, and phonophoresis on the epigastric region. First-line therapy includes 3-component therapy with adenol, amoxicillin, clarithromycin, and niforatel. Triple therapy. Recommended and most common scheme is adenol plus amoxicillin and clarithromycin, and quadratherapy. Criteria for the effectiveness of dispensary observation: complete clinical remission, the absence of pain and dyspeptic disorders, decrease in endoscopic and histological signs of process activity, complete clinical endoscopic morphological remission, the absence of clinical symptoms, endoscopic and histological signs of inflammation activity, and Helicobacter infection. After Helicobacter eradication, the inflammatory reaction on the gastric mucosa disappears within 2 and 6 months, and in the absence of clinical manifestations, doesn't require additional treatment. Thank you for your attention.